Prenatal assessment and screening are critical components of obstetric care. They aim to monitor the health and development of the fetus and ensure the well-being of the mother. These procedures help in the early detection of potential complications, allowing for timely interventions. Let's dive into the essentials of prenatal visits and routine assessments. These typically start in the first trimester and continue regularly throughout the pregnancy. In the initial visits, a detailed medical history is reviewed to identify any pre-existing conditions and potential risk factors. A comprehensive physical examination is also conducted, including measuring blood pressure and weight. Laboratory tests are a key part of these visits. Blood tests check for blood type, Rh factor, anemia, infections like HIV and hepatitis B, and immunity to certain diseases. Urine tests help detect urinary tract infections, kidney disease, or conditions such as preeclampsia. Genetic screening like the first trimester combined screening and non-invasive prenatal testing or NIPT assess the risk of chromosomal abnormalities. Ultrasounds are another crucial tool. A first trimester ultrasound around 14 weeks confirms the due date and checks for multiple pregnancies. A second trimester ultrasound usually done around 22 weeks examines fetal anatomy and assesses placental position and amniotic fluid volume. Now let's discuss specific screening tests. The first trimester screening includes a nuchal translucency scan, which measures the fluid at the back of the fetus's neck. Increased fluid can be a marker for Down syndrome and other chromosomal abnormalities. Biochemical markers like free beta-HCG and PAPA levels are also measured to assess chromosomal abnormality risk. NIPT analyzes fetal DNA and maternal blood to screen for chromosomal abnormalities with high accuracy. The second trimester screening, or quad screen, measures levels of AFP, HCG, estriol, and inhibin A in maternal blood to screen for neural tube defects and chromosomal abnormalities. Glucose screening for gestational diabetes is conducted between 28 weeks through a glucose challenge test or oral glucose tolerance test. When screening tests indicate a higher risk of abnormalities, diagnostic tests may be recommended. Chorionic villus sampling, performed between 13 weeks, involves taking a small sample of placental tissue to test for chromosomal and genetic disorders. Amniocentesis, conducted between 15 and 20 weeks, involves extracting a small amount of amniotic fluid to test for genetic conditions and neural tube defects. In conclusion, prenatal assessment and screening play a vital role in ensuring the health and safety of both the mother and the developing fetus. By identifying potential risks and complications early, healthcare providers can manage pregnancies more effectively, improving outcomes for both mother and baby. Thanks for watching. Don't forget to like, share, and subscribe for more informative